Hi everybody, it's Morgan Partica here. I'm a Deltec nursing student and I'm going to be teaching you guys about cirrhosis today. I'm also going to be including the nursing interventions, manifestations, diagnostics, labs, and I will be talking about liver transplants and a really cool study that I found, and I will be including a study guide at the end. So this picture is really cool. To the left, you have a normal liver microscopically. To the right at the top, you have a fatty liver microscopically. And then at the bottom right, you have the cirrhotic liver microscopically. So I just thought that was a cool picture. The liver does a lot of functions for the body. It removes toxic byproducts of medications. It prevents shortages of nutrients by storing them. It produces most of the proteins the body needs. It produces bile, which is used to digest fats and absorb vitamins. It produces substances for clotting factors. It helps your body fight infection by removing bacteria from the blood. And it also breaks down nutrients for the body to use as energy. Just a quick overview of cirrhosis. It involves fibrotic development in the liver. Each time the liver is injured or the liver progresses disease-wise, it becomes more and more dense and develops more and more scar tissue, which makes the liver less functional. And it usually results from hepatitis, chronic abuse of alcohol, non-alcoholic fatty liver disease. And early diagnosis can actually be reversed, but typically the signs and symptoms don't manifest until late in the disease, and it's usually too complicated to reverse at that point. Some signs and symptoms: you'll have fatigue, that fetor hepaticus, it's like that uric breath, your asterixis, it's like the hand flapping, easily bruising and bleeding, loss of appetite, nausea, some edema, weight loss, itchy skin, that jaundicing, ascites, spider-like blood vessels on the skin, redness in the palms, loss of periods unrelated to menopause, and men can even get breast enlargement, that gynecomastia. There's a lot of causes of cirrhosis. Typically, we have chronic abuse of alcohol, chronic hepatitis B or C, non-alcoholic fatty liver disease. You can also have some immune disorders that can cause it. You can also have some severe infections. Someone else is going to talk about hepatitis, so I won't get into this. I just thought this was a cool picture. The main risk factors for cirrhosis are alcohol abuse, obesity, and viral hepatitis, usually B or C. There are a lot of complications that accompany cirrhosis. Portal hypertension is a big one, and the normal blood flow in the vessels is decreased, and it causes a pressure that's bringing blood to and from the liver. That edema and ascites, you have increased portal vein pressure, and it causes a buildup of fluid in the legs and abdomen because the liver isn't making those proteins. Splenomegaly is an enlargement of the spleen. The portal hypertension causes entrapment of white blood cells and platelets, causing the spleen to swell, and it can even rupture, which is also dangerous. Bleeding, the blood's redirected to smaller veins for that collateral circulation, and they can eventually burst, or you can have like esophageal varices, things like that. And because you're not having enough clotting factors, it'll result in continuous bleeding. You can have serious infections since your body is trying to get back into that homeostatic balance, and it's not because the liver is impaired. Hepatic encephalopathy is another big complication due to the impaired liver function. There's a buildup of toxins in the brain, and that person can become very confused. Jaundice, because the liver's not removing the bilirubin fast enough, you're having that buildup and that yellowing of the skin, like you often see in like babies and stuff like that when they're not removing bilirubin fast enough. It's a little bit different. Liver cancer can also be another one. A lot of times liver cancer patients have a history of cirrhosis. Here's some preventative measures. This is kind of a surface slide, but I'm going to get into that a lot deeper later. Some diagnostic testing: you can have a CBC, liver biopsy to test the liver for different things, cancer, cirrhosis. Ultrasound just to look at the size of the liver and the vessels, your bleeding times, your PT, your INR, your APTT. Screening for hepatitis: look at those antibodies or antigens, see if you have a current infection or if you had an infection. Look at those serum bilirubin and albumin levels, they'll typically be elevated. Your creatinine to look at your liver or your kidney function, and your LFTs, your liver function tests. Treatment for cirrhosis, if it's alcohol related, they might need a treatment program or they need to start going to AA. Weight loss, if it's related to obesity, they'll usually be on antiviral meds, the VIR meds. They might need a liver transplant. There's typically a large amount of criteria. They have to abstain from alcohol for at least 6 months and they can't have any pre-existing cancers. They'll want to be on a low sodium diet, low protein diet to prevent that buildup of ammonia, which is a byproduct of protein, and the buildup of the fluid. Hypertension meds to control that portal hypertension, antibiotics related to any infections. Some lifestyle changes. This is your big education slide for your patients. Really educate them on no alcohol at all. And especially dieting, low sodium, adequate fruits and veggies, no raw seafood, frequent hand washing, getting their vaccinations for flu, pneumonia, hepatitis, avoiding those increased bleeding risk meds like aspirin, ibuprofen, acetaminophen, asking their doctor before they start any new medications, being aware of any restrictions that the doctor has told them about, writing down any symptoms they're experiencing or anything that they feel is off from their norm, keeping a list of their medications at all times, and writing down any questions that they have prior so they can really understand what's going on with their body. Collaboration of care is always super important. Patient-centered care is one of our number one goals. You're going to want to consult dietary. They can provide educational materials on an adequate diet, what to eat, how much not to eat, reading labels. A lot of people don't realize how much sodium is in a lot of different foods, especially like soups and stuff like that. Hepatology would obviously be consulted because they're focused specialists in treating liver diseases. Nursing interventions is another huge important part. That's for us, guys. Elevating the head of bed for shortness of breath. We want low plant-based proteins with vitamin supplements, restrict their fluids and salts, administering those diuretics to get that fluid off, monitor eyes and nose and weights with abdominal girth, always monitoring for a worsening condition, administering antacids, that lactulose, especially if their ammonia levels are high, which is a byproduct of protein. We can get rid of that. It'd be like 2 to 3 soft stools a day. Avoiding hepatotoxic meds like opioids, barbiturates. Again, remind them no alcohol whatsoever. Preparing the patient for any procedures and getting that informed consent, monitoring their glucose. They are a bleeding risk, so limit invasive procedures, holding pressure for 5 minutes, soft toothbrushes, electric razors. With varices, you want to watch for high energy activities, increased coughing, vomiting, any straining. Monitoring for skin breakdowns, always a priority. Monitoring their pain level and administering their pain meds as prescribed, and monitoring their level of consciousness associated with hepatic encephalopathy, which is a complication of cirrhosis. So I just want to talk about liver transplants. They're really cool. I'll show you guys that video in just a second. So it's a removal of the non-functioning liver and replacement with a functioning liver. You can have a deceased liver transplant, which typically the number of people waiting for an actual liver transplant outweighs the availability of them. And then you can have a living donor transplant, which is more popular. Typically family members or friends will donate them if they're compatible. But since the liver regenerates so fast within several weeks, they'll usually take out the diseased liver of the recipient and replace it with a portion of a healthy functioning liver, and then, like I said, that liver will regenerate. The causes are usually hepatitis, alcoholic liver disease, non-alcoholic fatty liver disease, some genetic diseases, severe complications with bile ducts. Some complications of a liver transplant can be bile duct leaks, bleeding, blood clots, rejection, infection, decreased level of consciousness. They're going to have a lot of health exams and lab tests, ultrasounds, counseling. A lot of stuff goes into any type of transplant before and after, because you don't want the body to reject it. You don't want to have complications, which a lot of times there are. With liver transplants, they use a MELD score, which is indicated for risks of dying within 90 days. So it scores from 6 to 40. The higher the score, the more at risk they are. Okay. So I just want to show you guys this video. Oh, there we go.
The following are the technical steps of a whole organ liver transplant. To begin the procedure, we need to remove the diseased native liver. To do so, we divide the blood supply and the bile duct. We first divide the right and left branch of the hepatic artery. The common hepatic and cystic ducts are divided. The portal vein is divided. A clamp is applied to the inferior vena cava, or IVC, below the liver. Another clamp is applied to the IVC above the liver. The hepatic veins are divided. The IVC is divided. The IVC is divided below the liver. The diseased liver is removed. In preparation for the vascularization of the to-be transplanted liver, the openings of the hepatic veins and the vena cava are made into a common channel. This maximizes the outflow of the to-be transplanted liver blood flow. We also create a common opening for the hepatic artery. A whole organ transplant is when the entire liver from a deceased donor is used for transplantation. We begin by connecting the top of the donor IVC to the patient's IVC. Then the IVC below the liver is connected to the patient's IVC. Next, the portal vein is connected, the clamps are removed, and blood flow in and out of the liver is restored. The hepatic artery is connected. Lastly, we connect the bile duct. It is common to be in the hospital for several weeks after the operation.
Okay, sorry about that. So I thought that was a really cool video just to get you to understand how a liver transplant is performed. And then I found this really cool study. It was a little bit limited because it was only limited to 8 pigs, but it was to cure or slow the progression of cirrhosis. It was done by a research team at Cornell Medicine. So they took blood vessel lining cells from healthy pig livers, and then they infused them into pigs that had cirrhosis. Of course, they made them have cirrhosis, severe cirrhosis. And there was no bleeding or clotting or any harm done from the infusion of the cells. And there was a reduction of markers related to cirrhosis in these pigs that had cirrhosis. The endothelial cell therapy can actually rejuvenate this niche to produce angiocrine, which angiocrine is a factor that promotes regeneration, which of course with cirrhosis, the liver is not regenerating itself because of the scar tissue. So the thoughts behind the therapy is that by infusing these endothelial blood vessel cells, it can either stop or slow the progression of the disease or even cure them to an extent. And again, like I said, it was limited to 8 pigs. But then the remaining hepatocytes of a impaired liver can suppress the progression of the fibrotic development. So I thought that was a really neat study. Here's my references, guys. If you do have any questions, you can email me at mpartyk1@dtcc.edu. Again, if you guys do have any questions, just let me know, okay? Thank you so much.